Good afternoon, everyone. You are very welcome to the Irish Cancer Prevention Network Reducing Cancer Risk annual webinar. The panel will be delighted to receive any questions you may have today. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to your host, Dr. Trina McCarthy, Consultant in Public Health Medicine, National Cancer Control Programme. Thank you.
Good afternoon, everyone, and on behalf of the Irish Cancer Prevention Network, a very warm welcome to our webinar this afternoon. We have an exciting lineup. We're going to share results of a national survey that's been carried out on cancer awareness, and so understanding of risk factors and early signs and symptoms of cancer, and then also have a lot of information from a number of our partners on targeted initiatives. So our first presentation today will be from Kieran O Leary, who's the Director of Ipsos Ireland, and Kieran is going to share with us some of the findings of the National Cancer Awareness Survey. So I'll pass over to Kieran. Thank you.
Thank you very much, Trina. Yeah, I'm delighted today to have the, sorry, I'm sharing my screen here. Sorry, yeah, I'm delighted to say to have the opportunity to share with you the results of the first national study of awareness and attitudes towards cancer. It's the first of its kind that's been undertaken in Ireland, and it's coming at a very important time. It's a very important study. It's important for two reasons. First, being the first of its kind in Ireland, it gives us a baseline measurement in order to address some of the gaps that we all know exist, and to give us metrics around that. And secondly, it also gives us comparable data to those that have been collected in other countries around the world. So we've used some of the measurements and some of the questions that have been asked on similar surveys undertaken in the UK, in France, in Australia, in Denmark, and many other countries as well. So it allows us to look at the situation and the experiences in Ireland and how these compare to other countries and how these can be improved as we move into the future and build people's awareness and understanding. So the study that we undertook, so it's quite a large survey. So we surveyed nearly 3,000 people, 3,000 adults living in Ireland, aged 18 and older. This was all done in the kind of first half of this year. So the data that I'm sharing with you today is all quite recent and gives us an accurate picture of the situation in Ireland. The participants for the survey were selected through a random digit dialing process or telephone surveys that were conducted. So it gives us a good nationally representative picture and data that we can rely on. And being such a large sample size allows us to dig into quite small groups and to understand how their situation may differ, how their attitudes may differ compared to other groups in the population. Those that we selected to take part in the study, or those that were selected to take part in the study, the study was naturally abided by some of the best principles in terms of ethical guidance and so on. All the participants had the opportunity to provide informed consent to take part in the study. And also, given the nature of the study, the interviewers received very specific training in terms of the sensitivities that may exist around this study, and particularly in terms of sensitivity training that was provided and delivered by the Irish Hospice Foundation before the study got underway. So what did we cover on the survey? And I suppose these areas kind of match up, I suppose, in terms of the structure of the presentation that we're going to go through over the next 20 minutes or so. First, we looked at assessing some of the beliefs around cancer, assessing some of the early signs and the knowledge of some of the early signs and symptoms of cancer, and also then some of the health-seeking behaviours, particularly in terms of likelihood to seek advice, to seek medical advice, and also exploring some of the potential barriers that may prevent people or put obstacles in the way of people in terms of seeking some of the advice that they may need to seek. As I mentioned, the survey questions we used were taken from a number of international studies, as well as some of the local studies that are conducted here, and it was all designed in very close collaboration with the National Cancer Control Programme and a wider research advisory group drawn from various places. So without further ado, let's dig into some of the results of the study. Firstly, I suppose one of the first things we wanted to ask about was just to understand people's position in terms of cancer. So first, we asked about the people's experiences with cancer. So the question we asked, firstly, have you, anyone in your family, or any of your friends had cancer? And what really comes across here is the broad extent to which cancer has impacted on almost everyone in the population. 86% were able to identify someone from within their reasonably close circle who has had cancer. Most people identifying someone in their immediate family or someone in their wider family, picking out, being able to identify someone who's had cancer. So cancer has certainly touched so many people in the population. And not just that, but obviously potentially, there were a number of people interviewed who they themselves had cancer, currently have cancer. So 6% of the respondents that we interviewed say that they themselves have had cancer. And of that group, 15% say they're currently undergoing treatment for cancer. So cancer, as we know, touching on so many people across the population and the impact of that. We then, I suppose, wanted to get an understanding of what people, people's initial reactions to cancer. So we asked a very open question. So we said, again, this is right at the start of the survey, and we said, when I say the word cancer to you, which 3 words does this bring to mind? So we didn't prompt them with any words. We didn't give them lists of any words. This is all off the top of their heads, and it really gives us an idea of people's perceptions of cancer. And unsurprisingly, I suppose, as you'd expect, some of the words that came out initially for most people were quite negative words, and you can see those quite to the top, quite the top of the list. So things that people might be fear, so fear, death, disease were the most commonly mentioned words, with over at least 4 in 10 of people that we spoke to mentioning at least one of those words. But there's quite, you look down through the list there, and there's quite a lot of sort of negative words, but there's also some positive connotations coming across here. We can see things like hope, 10% mentioned that, curable 6%, and then some various treatments around that. So overall, obviously, as you'd expect, people being quite negative, but some positivity begin to creep in for some people, or some positive sentiments. That goes on then, and we ask very direct statements then to people, and we ask them, in terms of trying to measure their sort of perceptions of cancer. So we presented 4 statements to people, which you can see on the screen there, and then we asked them the extent to which they agree or disagree with each statement. So you can see the agreement there, the blue and the green, and the disagreement there, the orange and the yellow, for each of those statements. So the statements we presented, 2 were positive. The 2 on the left-hand side of my screen there were quite positive statements, and the 2 on the right-hand side then being quite negative. So we can see overall, agreement level, some optimism around cancer coming through there on the left-hand side. Cancer can often be cured. We've almost 90% of people agreeing with that. These days, most people with cancer can expect to continue with normal activities and responsibilities. Again, very high proportions of people agreeing with that. On the right-hand side, then we can see some of the, some of the more negative connotations. The diagnosis of cancer is a death sentence. Nothing can be done to reduce your risk of cancer. Now, most people do disagree with that, matching up with what they said to the first 2 statements there. But we can see, again, some of that fear creeping through there quite strongly. 25% agreeing that a diagnosis of cancer is a death sentence. So a quarter of the population overall feeling that is the case. Some differences exist across the population. If we look at older people much more likely to agree with that statement than younger people are to agree with it. So a lot of the fear coming across there, particularly in those groups. That said, one of the other statements we presented to people is, there are things I can do to reduce my risk of developing cancer. And very, very high level of agreement with that. So 90% overall feel that, at least somewhat agree that there are things that they can do to reduce their risk of developing cancer. So really, really strong levels of agreement with that, and that people can take steps to do things and have the right behaviors that will reduce their risk of developing cancer. Now we can see, that it's quite high levels across the population. That said, we can pick out some little differences starting to come out here. We see again, older people, they're as likely to agree with it, but the extent to which they strongly agree with it is lower than people younger than that. So we can see older people maybe slightly less likely to feel that there's things that they can do to reduce their risk of developing cancer. But overall, across the population, we can see quite positive outlook in terms of that, and that people can take steps. Now, digging into some of the more some of the lower level detail here, and quite a lot going on in this slide here. But essentially, this presents the results of 2 questions that we asked people. The first question we asked them is, what things do you think could increase a person's chance of developing cancer? We didn't give them any list. Off the top of their head, we asked them to identify off the top of their head things that they think would increase someone's chance of developing cancer. They could have selected as many or as few as came to mind. And they're the results that are presented there in the blue bars there. Then what we did was the ones that they didn't identify, we read out the remaining list, and we said, for each of these, do you think it could increase a person's chance of developing cancer? So it gives us a spontaneous measurement and a prompted measurement in terms of some of the cancer risk factors. There's a mixture of things on here. You can see there's things here which are have a proven link to cancer, and then some other things which not a proven link to cancer. We wanted to get a measurement of 2 of them. But that said, we can see that there are some things that really jump out here quite strongly. the link between cancer and smoking is very well established in people's minds. And you can see that 81% spontaneously identified smoking tobacco products or smoking as being something that could increase increase someone's risk of developing cancer. We can see then if the people who didn't identify it, once we mentioned it to them, virtually everyone identified that, and recognized the link there. After that, then we can see that the link, the things that come top of mind to people really sort of falls off. We can see alcohol there, 42% is the thing next most likely to be identified as increasing someone's risk of developing cancer, and unprotected sun exposure spontaneously anyway, and after that, but nowhere near the levels that we're seeing in terms of smoking tobacco products. The two other interesting things worth picking out from this as well is firstly, in terms of smoking, we don't see much difference in terms of smoking status, whether someone smokes or not. They're as likely to pick that up. The other interesting thing is that if we look down at drinking alcohol there, which is well down the list, which is quite high levels of spontaneous recognition, 42% say that alcohol has got potentially some link in terms of increasing your risk of developing cancer. But for people who didn't mention it, not a relatively small proportion went on then to agree that it does increase someone's risk of developing cancer, and it drops well down the list. And as we'll come on to see, there's quite a mixed picture in people's mind in terms of the links between alcohol and cancer, and the picture isn't as clear cut for many people. Digging into some things here, and here we're looking at, we probed a bit more detail in terms of looking at the link between cancer and tobacco smoking, and we can see we presented 4 statements there, in terms of some of the perceptions, the link between smoking and cancer. But overall, what we can see is that there's quite high levels of agreement to some of these to some of these statements. Even if you don't smoke yourself, being exposed to other people's smoke can cause cancer. 90% agree with that. A former smoker can get cancer related to smoking even a long time after quitting. Again, quite high levels of agreement of that. We can see a small difference between smokers and non-smokers. Here, we can see smokers a little less likely to identify the link between smoking and cancer. It's not huge, but it certainly exists. But where we can see the largest difference, which is quite interesting, is on the statement in relation to secondhand smoke. So even if you don't smoke yourself, being exposed to other people's smoke can cause cancer. That we see smokers, are a good bit less likely to agree with that statement than non-smokers are. So perhaps, and it's one of the findings coming from the research, perhaps a bit of work to be done in terms of just reaffirming that link between secondhand smoke and cancer, particularly amongst smokers. Then when it comes to alcohol, we can see a really mixed picture here. So, across all of the kind of these statement things I've shown you so far, it's kind of all dominated by, one color or other. Here we can see much more of a rainbow of colors going on here, which suggests to us, a much greater sort of diversity in opinion in terms of what people think. And this is in terms, some of the cancer risk factors around alcohol. So we can see then across all of the statements here, you can see almost as many people agree with the statement as disagree with the statement. So we can see as much blue and green as we can, orange and yellow on this on the screen here. So people are much more uncertain in terms of the link between alcohol and cancer. So we can see that levels of agreement a little bit higher in terms of some of the heavier alcohol consumption here, and perhaps there's something creeping in here around the myth of the health benefits of alcohol consumption. And we can see 39% agree that drinking a little alcohol is better for your health than not drinking any alcohol at all. So some of those myths that have been established over time, very much prevalent in people's minds. We can see a small bit of a difference by alcohol consumption. It's not as big as it is for smoking. We can see that those who drink alcohol are a little their belief of the link is a little bit less than it is amongst non-drinkers. But we can see pretty large differences by age as well. So we can see that older people much less likely to identify the link between alcohol consumption and cancer as younger people are. And then perhaps reflective of, changing drinking patterns over time, perhaps coming through in terms of that. Sun exposure then is another area that we dug into in quite a lot of detail here, and here we're looking at some of the steps that people take in terms of some of the sun protection measures they take during the summer in Ireland. So we asked them 3 things that they may or may not do. So we asked them the extent to which they do these regularly during the summer in Ireland. So wearing long sleeves, a hat or sunglasses, using sunscreen of at least factor 30, and limiting the time spent in the sun. And we can see that most people say, oh, that they do these things regularly or frequently in Ireland during the summer. But only 5% saying no, they don't do any of those 3 things on a frequent basis. Now, obviously, here we're looking at reported behaviours here. There may be a bit of what we call a social desirability bias coming in here, that people feel that they should be saying these things now, and the extent to which people may do it may not match up with that exactly. The other thing that we asked parents of children under 12. So we asked them the extent to which they take these steps for their child. And so we asked about we see that 97% say they use sunscreen of at least factor 50 for their child in Ireland, then in terms of wearing long sleeves, sun glasses, and limiting the time spent in the sun, very high proportions also saying that they do this with their child, or the child does this during the summer in Ireland. Coming on then in terms of recognition of some of the cancer signs and symptoms. Again, we took the same measure as we did with some of the risks. So again, we asked people spontaneously. So we asked people without presenting them with the list. There are many warning signs and symptoms of cancer. Please tell me as many warning signs and symptoms of cancer as you can think of. So again, these are presented in those blue bars there. So we can see the things that are top of mind for people in terms of in terms of some of the signs or symptoms. And then, for the ones that they didn't identify, we asked them to, we read them out and we asked them to identify these. And I suppose the important thing here is obviously spontaneous recognition of the signs and symptoms is absolutely crucially important, is that people need to recognize if something happens and recognize that's potentially a sign or symptom of cancer, and take the steps rather than necessarily being prompted for this. So the key thing here, of course, is the spontaneous recognition of that. So we can see overall spontaneous level, with the exception of unexplained lumps or bumps, which was top of mind for about 3/4 of people. Outside of that, then we can see that there's no sign or symptom there which the majority spontaneously identified. We can see a few in the kind of 30s, but nothing getting majority recognition. So perhaps a bit of work to be done that in terms of raising and further establishing the awareness of some of these signs or symptoms. We can see then that that we can see spontaneous recognition is a bit higher in some groups, and particularly women and those aged 35 to 64, a bit more likely to pick out some of these signs and symptoms spontaneously than some of the other groups. In terms of some of the steps that people would take, so we asked people, if you were to notice a physical sign suggestive of cancer, what would you do first? So 72% responded that they would discuss it with a doctor first. So encouraging levels of response there is that they would, the step that they would take is to seek information from a professional health provider in terms of that, rather than necessarily going off and doing something else. Now, obviously, this is claimed what they would do, and put people in a situation, their behavior may be a little bit different. They may go elsewhere first before going to a doctor. But we can see it's very, very encouraging that there's recognition of that is a step to be taken. We can see it's not, that we can see a bit of a gradient here, and that slide, that's chart there pretty much in the middle of the screen. So the proportion reporting that they would discuss with a doctor first, we can see younger people less likely to say that they would do this. Still the majority of 18 to 24-year-olds, 63% say they would do it, that's the first place they would go, but we can see it's a little bit lower than the older age groups, and this could be reflective of a couple of things. that obviously their interaction with health professionals may be lower amongst younger people than it is amongst older people, or their access to other information sources may be a bit higher as well. So they may be more likely to do other things. Then what we ask is in terms of the acting early on a sign or symptom of cancer. And we can see it again, recognition of again, here we've got agreement scales here. So you can see quite encouraging on the left-hand side, recognition that going to the doctor as soon as possible after noting a sign or symptom of cancer can increase your chances of survival. Almost everyone agrees that is the case. And we see quite low proportions on the very right-hand side. I would not want to know if I had cancer. 13% agree with that. So most obviously disagree with that. But the concerning thing is probably in the middle of all this here is one of the statements we presented to people, which is most cancer treatment is worse than the cancer itself. Now, the majority agree that that is the case, and this is maybe fueling some fears around cancer. And of course, this is around cancer treatment. And this is, of course, absolutely crucial in terms of encouraging people to take steps that they're not going to take, maybe less like to take the steps if they're fearful of what the outcome of taking those steps may be in terms of the treatment around this. And we can see then, that fear is a bit higher in some groups. And particularly, I'm going to pick out, identify women here. 61% agreed that most cancer treatment is worse than the cancer itself, and also 60% of those aged 65 plus. Now, they're the groups most likely to say they would seek out help and seek out professional support if they know it's a sign or symptom. But we can see that there's particular fears around the cancer treatment for some of these individuals. Now, the final bit of data I'm going to show you here is looking at I mentioned at the start that we asked about some of the potential barriers that could stop people from seeking out help, and particularly here we've asked about, we read out a list of potential things, and we said for each of the following, can you tell me whether it would stop you or not stop you from visiting a doctor if you notice a warning sign or symptom of cancer? So things you can see at the top of the list there: I'd find it difficult to get an appointment, I'd find it difficult to get an appointment at a convenient time, the financial cost of attending a GP. So a whole range of potential things which could potentially prevent someone or put an obstacle in the way of someone going to see their GP. Now, encouragingly, most, the vast majority said that none of these things would stop them from going to a GP. So be it cost, or be it concern about wasting the doctor's time, whatever it might be, anything we presented them with, they said, no, that wouldn't stop me from going to see a GP. Now, that said, there were things that did affect some groups more than others. And we can see, things around cost and getting appointments. We see they come top of the list here, but if we dig into some of the groups, and particularly younger people, so particularly under 35s, we can see around about 20% of under 35s said that the cost of going to a GP would prevent them or might stop them from going to the GP. The difficulty of getting an appointment at a convenient time, again, 20% of under 35s identified that as something that might stop them from going to see a GP. So they're obviously particular, they're key things, and particularly in terms of addressing with that group, who of course are probably have less frequent interaction with GPs, and perhaps more, that obviously for a lot of that group we have to pay to get access to GPs, which may not be the case for many in some of the older age groups. So, in conclusion, then, some of the things that come out from this, one of the key things in terms of some of the cancer risk factors, the high levels of awareness of the link between tobacco and cancer is very much established here. However, what we can see then is it's perhaps slightly lower in terms of perceived risk of secondhand smoke. We can see 1 in 10 smokers do not agree that secondhand smoke increases cancer risk. So perhaps that's an area that requires particular focus over the while, and to just reaffirm with those smokers that yes, that is a high risk factor for people. Alcohol then is potentially one that does need a lot of focus here, and we can see there's a very, and reflective of perhaps the confusing relationship that Irish people have with alcohol, and that comes across really strong, very strongly through this survey here, and it's quite a mixed picture, and we can see that it definitely reflects this perhaps a myth that that a little bit of alcohol is good for you, or that moderate drinking is there's no risk in that, which of course we know is not the case, and there's always a link there. Older people and those who drink more frequently, are less likely to associate the risks there in terms of the negative health effects of alcohol. Spontaneous awareness of some of the cancer warning signs is quite low, with the exception of lumps or bumps. We saw only a minority were able to identify off the top of their head some of the potential cancer warning signs, so that there's more work to be done around that. And also then finally some of the barriers to cancer treatment here. For most people, they don't identify, most people say that they would go to a GP and they don't identify any barriers that would prevent them going to a GP. But we can see for some groups, they're less likely to say they'll go to a GP, and they're more likely to pick out barriers that would prevent them from doing so. And particularly in that younger group, that under 35 group, it's a potential barrier there. Not for most of them, but certainly for some of them, and it's a barrier then that needs to be looked at in terms of how do we reduce that perceived barrier. So that concludes the presentation for today. There's quite, as you can tell from the way in which I've flown through the data, there's quite a lot there. There's a written report which accompanies this, which goes into some of those findings in a lot more detail and digs into some of the smaller groups. So thanks for your time today and for listening to the presentation. And I do hope that you find use in some of these results in your area of work. Thank you very much. And back to you, Trina.
Thank you, Kieran. And I think we all agree this is going to be a really useful resource and will be so important in guiding our priorities over the coming years. I'm going to introduce 6 short presentations that are going to follow. I'll introduce everyone and let's let people run back to back. We're going to hear from Áine Lyng, who's a Senior Cancer Prevention Officer with the National Cancer Control Programme, who'll speak on some national cancer risk reduction initiatives. Dr. Caroline Mason-Mahon, who's the Director of Public Health in the National Screening Service, will speak on some screening service initiatives. Sharon Toole, who's a Senior Research Fellow in the Trinity Centre, will talk about World Go Day plans. And then she'll be followed by Maria McHenry, Senior Cancer Prevention Officer in the National Cancer Control Programme, speaking about some national skin cancer prevention initiatives. Helen Forrestill will be presenting on Marie Keating Foundation initiatives. And then finally, Dr. Conor McAllister will be speaking on behalf of the Irish Dental Association in relation to Mouth Cancer Awareness Day. So we'll share those with you now.
Hi, my name's Áine Lyng, and I'm a Senior Cancer Prevention Officer with the HSE's National Cancer Control Programme. Today, in this rapid fire presentation, I'm going to talk about some of the national cancer risk reduction initiatives that we run. The initiatives that I'm going to tell you about, they're inclusive. We try and make sure that anything that we do supports health and social care professionals in the work that they do with various different populations. One of the first things that I do want to acknowledge is every person's risk of getting cancer is influenced by a wide range of factors. There's things we can't change, such as our age and our genetics, and there's things that we can change, such as our alcohol intake, our vaccination uptake, our physical activity, or protecting skin from the sun. We know that about 30 to 50% of cancers can be prevented. It means there is a whole host of cancers that we can't prevent, but we do know that, look, we can all take steps to reduce our risk of cancer. Today, I'm going to talk to you about 3 different initiatives that we run that might support you in your work. I'm going to talk about evidence and research that we do, education programs that we run, and resources and support that's available to you. First of all, if I talk about the evidence and research that we do. Now, Kieran's already presented to you on the National Cancer Awareness and Attitude Survey with the general population, and hopefully that information will support you in the work that you do and inform any initiatives. Before that survey, we actually conducted a national survey on lung cancer awareness in 2020. This survey itself, it was conducted with adults over the age of 50 living in Ireland. The reason it was adults over the age of 50 is this population have are more likely to be diagnosed with a lung cancer rather than a younger population. The survey itself, there were 750 telephone interviews conducted nationally, and then 250 face-to-face interviews conducted in Carlow and in inner city Dublin. The reason these interviews are conducted face-to-face in those two localities was due to the prevalence of risk factors and the proportion of late-stage diagnosis of lung cancer in these areas. So there's one interesting stat that did come from that survey was that 90% of those interviewed were aware of smoking as a risk factor for lung cancer, but only 1% were aware of radon as a risk factor for lung cancer. If you are running any initiatives in relation to reducing risk of lung cancer or early diagnosis of lung cancer, I would encourage you to look at that survey and the information within it. We are about to take national cancer awareness research with social inclusion groups. We're starting with the traveller community, and we hope to spread this research into other social inclusion groups as time progresses. The research with the traveller community, the project plan has commenced this year, and we'd hope to publish results next year. Again, we'd hope that this information and this data can inform you with regards to initiatives that you're going to run with the groups that you work with. We also run some education programs. And again, the purpose of these education programs, it's to support you, health and social care professionals, to understand what are the modifiable cancer risk reduction behaviours and what supports are available for the populations that you engage with. We're in the process of publishing our short course e-learning modules. These modules are on HSE Land. They're about modifiable cancer risk reduction behaviours and they're for health and social care professionals. Each module, it explains how a risk factor affects cancer risk, which cancers that this risk factor is related to, and it signposts to support further information for yourself and for the population that you work with. The modules themselves, they take about 10 to 15 minutes in length. We have 11 modules in total, and today we're actually launching 3 of these. So it's reducing cancer risk in alcohol, reducing cancer risk in tobacco, and reducing cancer risk in skin protection. If you log on to www.hseland.ie and type into the search bar these modules' names, you'll be able to find them. We will be publishing more modules across 2023, and the topics that we'll be publishing modules on are body weight, eating for health, physical activity, radon, screening, HRT, breastfeeding, vaccines, and workplace carcinogens. And the idea of these modules is trying to support you and educate you about what are the modifiable cancer risk reduction behaviours and where you can access more support for your populations that you work with. And finally, if I signpost you to the resources and support that are available, you can see on the screen there some images of resources that we have developed. All of our resources are housed on www.hse.ie/cancer prevention. We've got videos, we've got posters, we've got leaflets, we've got fact sheets. If you go onto our webpage, you'll be able to see what might work for you and the work that you do. You can also visit healthpromotion.ie. On healthpromotion.ie, you can choose the cancer drop-down, and you'll see a number of our resources there that you can order for prints. And finally, if you contact prevention@cancercontrol.ie, you could submit a request for a resource, or if you've got any questions, we'll get back to you with some advice. I said at the beginning, not every cancer is preventable, so early diagnosis is important. It's so important that if anybody notices a sign or symptom of cancer, that they act early and they contact their GP. To support you in your work, engaging with various different populations, we also have a number of resources and education available to you. If you visit our webpage, www.hse.ie/cancer early detection, you'll see all of our resources there, including past webinars. Again, if you go to healthpromotion.ie, choose the cancer dropdown, you'll be able to order some of our resources to print. With the early diagnosis resources, you can see that they're graphic heavy, and we're trying to make them as easy read as possible. And finally, we also have some education on HSE Land. If you go to hseland.ie and type in early diagnosis of cancer, you'll be able to access the e-learning module there. Finally, the call to action. I've outlined some of the initiatives that we're currently running and some that are coming down the line. If you sign up to the Irish Cancer Prevention Network newsletter by contacting prevention@cancercontrol.ie, you will receive our quarterly newsletter, which will provide updates on various different initiatives that are running at various different times of the year. I wish you all the best in your own work, and thank you for your time.
Hi, I'd like to thank the Irish Cancer Prevention Network for inviting me to present at this webinar. My name is Caroline Mason-Mahon. I'm a consultant in public health medicine, and I'm the Public Health Director in the National Screening Service. I've been asked to tell you a little bit about the work we're doing on equity and social inclusion. I only have a very short time, so I'll whip through as much as I can. So equity is really important to us in screening because it affects the outcomes from the programmes. If we don't get good representation in our screening services from all sectors of society, we're at risk of increasing the health inequalities across the population rather than decreasing them with this population health intervention. There are 3 cancer-related screening programmes in Ireland: breast check, cervical check and bowel screen. And I've got a resource slide at the end of this talk that will link you to details of those programmes if you're interested. Taking part in screening is a choice, and in the National Screening Service we take a lot of care when we develop information to ensure that they can make an informed choice about taking part in our programmes. And this is important because screening programs aim to improve the health of the population, and in doing that they do improve, for some people, their own personal health, but there's also a risk that they can cause harms, and one of those harms, for example, is over-diagnosis and over-treatment. So we want people to be very aware of what they're getting into with the population screening program, and that they make an informed choice of what is right for them. So to do that, we need to understand how they make choice. So this is taken from vaccine hesitancy evidence. Confidence, complacency, convenience, communication and context all affect how people make their decisions. And we pay attention to all of these in screening, but today I suppose I'm going to talk to you more about the convenience of it, the access to all services, communications, and the context in which people make decisions. So that talks about really their environment, their ethnic background, or whether they're members of any particular marginalised group, where there could be structural issues in our society that prevent them making a good choice for themselves around screening. Our own research in the NSS supports that. We know that low knowledge about screening, fear of what might be found, ability to access our services, and their feelings about whether our services are trustworthy or not, all affect people's ability to decide what to do when they're offered an opportunity to take up screening. For people who make that choice, some of them still have access as a problem, and so that is one of the areas that we take very seriously as well. So what are we doing about this? Well, access is one of them. We have 4 access officers, who are senior health promotion officers, and they give individual support and help to people who contact them who have access issues. But they also take the learning from those contacts to ensure that we can help other people across the population. And the sort of things that have come from that work that they do is we've developed easy read resources, we've developed Braille resources, translated resources, both videos and written, large font resources, and we've also had success in increasing the number of mobile units that are available for breast checks so that the screening can be done close to people's home. We also work with communities, and we've been engaging with them to understand the specific needs that the particular communities have. And so, for example, so far, we've done a needs assessment with the LGBT+ community, which has given us great insights into what affects them accessing screening. And Cervical Check are now implementing an action plan from that work. We're working collaboratively with disability groups to do a needs assessment and understand how we can improve our services for them. And these will be finished later on in the year and for implementation from next year. The translated resources that I mentioned earlier were done as a co-design project with migrant communities supported by social inclusion in the HSE and health advocates. And those are available at the asylum seeker centres as well. Another area that we do a lot of work on is training and education. We recently worked with Pave Point and one of the community health organisations to design and deliver training for traveller peer health workers. and that's to support them in supporting their own community in making a choice about screening. And we know that travellers often have lower access and usage of health services and screening. We also did a similar piece of work with intercultural health advocates. So it's important to work with communities because we can be oblivious to what their needs are unless we ask them. And there are many cultural influences on their health as well that need to be taken into consideration. If we don't work with the communities, then we can end up with solutions that completely miss what the problem is for them. We also in the NSS have been improving our patient voice input to our services. And we have a public patient partnership strategy, which is currently in implementation. And finally, we're going to draw all of this work together into an equity framework, starting in the next few months. And again, that will be guiding from next year the work that we do in the future around trying to improve equity and address social inclusion issues that prevent people from getting full benefit of these publicly funded population health programs. So thank you for listening, and I'll just leave you with the resource slide that I have, and I'm happy to share these slides after the webinar. Thank you.
So I would like to thank the organisers for giving me this opportunity today to outline our plans for World Gynae-Oncology Day. So I'm speaking to you today on behalf of the Irish Network for Gynaecological Oncology, which comprises over 30 of Ireland's foremost gynae cancer campaigners, researchers and patient advocates across the island of Ireland, including the members of the Irish Cancer Prevention Network. Our aim is to raise awareness of gynae cancers, and we have two big campaigns: World Ovarian Cancer Day on May the 8th and World Gynae-Oncology Day on September 20th. World Gynae-Oncology Day was established in 2019 by the European Network of Gynae Cancer Advocacy Groups, who we work closely with. So just to highlight for you that there are 5 gynae cancers, and the colour purple encompasses all the gynae cancers. And in Ireland, we see over 2,000 cases of gynae cancers annually. This infographic, which we will be sharing as part of our campaign, really highlights the symptoms of the 5 gynae cancers. Last year on World Go Day, we ran a very successful Dare to Ask campaign as the theme was communication, and really encouraging women, I suppose, to ask those questions they were always afraid to ask. So we partnered with the Answers for Cancers podcast team and ran a special series of all of those questions. We also had a number of buildings across the country lighting up in purple. This year, the theme for World Go Day is endometrial and uterine cancer. And it's really, I suppose, highlighting the benefits of being a healthy weight, you know, and your risk for endometrial cancer. We are going to run a very fun dip or dance initiative to encourage women to be more active and maintain a healthy weight. We will be mobilising swim groups across the country, and the swim hats are kindly sponsored by the NCCP. We're also hoping to run a dance initiative in Front Square of Trinity, where we'll be getting women to wear the World Go Day t-shirts and take part in a fun dance initiative. We're making a special concerted effort for social inclusion, and we'll be working with our partner Mary Keating, as they have done some excellent work in this area, and Helen would have outlined their work in terms of the Midlands and Pavek Point, but also with the Syrian refugee community and Jesh schools. We will also be working closely with the Muslim community. So I'm leaving it with you with the hashtags for World Go Day and also with my contact details. And if you want more information on the gynecological cancers, you can go to thisisgo.ie. Thank you.
Hi everyone, my name is Maria McHenry and I'm a Cancer Prevention Officer at the National Cancer Control Programme, and I am coordinating the implementation of the National Clean Cancer Prevention Plan. So the current plan runs till the end of 2022, and we are currently in the process of writing our new plan for 2023 plus. So I suppose the plan aims to tackle the rising incidence of skin cancer here in Ireland, to increase awareness and engage people in UV protective behaviours such as protecting their skin from the sun, and also to not use sunbeds. So currently there is just under 13,000 cases of skin cancer diagnosed each year. And as you can see from the projections on the screen here, both for melanoma and non-melanoma skin cancer, the rates are increasing year on year. So there's a lot of work for us to do in this area. So as part of the skin cancer prevention plan, there are certain at-risk groups that we're specifically targeting, and those are children and young people, outdoor workers, those that pursue outdoor leisure activities, and also sunbed users. So there is different work streams that are progressing with priority groups, but today I'll be focusing on working with the travelling community and I suppose looking at work that we've already undertaken and work that we are planning for the next year. So just to give you some background information, research done in 2018 found that there were significant differences in relation to cancer, skin cancer, and specifically in the use of sunbeds for the travelling community. So there were low levels of awareness of the risks of sunbed use. Also, women linked tan skin with health, beauty, happiness, and believed that sunbeds were good for their health, as in having a positive effect on conditions such as arthritis and psoriasis. And then for men, use of sunscreen was regarded as a sign of weakness, and tan skin was associated with health and well-being. So I suppose based on research that's been undertaken, we wanted to look at ourselves with the different at-risk groups, how we could progress some work with the travelling community. So the HSE National Cancer Control Programme, in conjunction with Department of Children, Equality, Disability, Integration and Youth, as well as the National Participation Office, undertook a consultation with young people aged between 12 to 18. And this was undertaken last year in 2021. So I suppose the aims were to gain greater knowledge of the attitudes and behaviours in relation to skincare in the sun, also their use of sunbeds, so how often they use them, and how to get promotion of health messages to this population group. So based on the consultation that we held, there was a lot that we learned. So the best person to get health information from is parents or healthcare professionals. The best way to get information to them is through word of mouth, through the radio, through personal stories, so people who have gone through a form of skin cancer. And then I suppose when it came to social media and platforms like Facebook, it was quite mixed. So some people trusted it, some people didn't. A lot of them would look for reliable sources, such as government bodies. The reasons for using sunbeds, there was a wide range of reasons given for why young people would use sunbeds. Many were to tan, to be attractive to the opposite sex, for positive self-image, self-confidence, to feel happy, also preparing for a holiday, so a holiday overseas or abroad. And then I suppose when we looked at reasons for not using sunbeds, that included skin damage, the aging effect, health risks, cost, or not being allowed to use them. So I suppose based on the consultation last year, we then looked ahead for this year for our Sun Smart campaign, and we included radio adverts directed to adults. We also have a skin protection e-learning module, which we have developed for health and social care professionals. And then we included personal patient stories to share on our social media and also through the press. We've also raised awareness of the risks of sunbed use on social media platforms. So specifically platforms that young people would use, such as TikTok, Snapchat, Instagram. And I suppose these were shared throughout the SunSmart campaign, which runs from April right through to September. So they're still ongoing at the moment. We are hoping to do more focused education events with Pave Point directed at young people to, I suppose, raise awareness of the dangers of using sunbeds. And the consultation report is available on our website, but it was also shared with organisations who work closely with the travelling community. And I suppose that's to help inform them of initiatives that they are planning or undertaking. Then I suppose when it comes to sunbed users, we did a project in 2021 with Pave Point. So we developed a leaflet on the dangers of sunbed use, and we also ran a train the trainer format with their health workers in the Fingal and Blanchardstown area. So I suppose what happened is we gave them the training, they then went out to the community, they handed out the leaflet and they informed people of the dangers of using sunbed use. And we got really positive feedback from it, from the travelling community after that education pilot that we ran. When it comes to outdoor leisure, we have provided wide-brimmed hats to children attending summer camps in the northeast inner city of Dublin. We also provided coaches with those hats, and I suppose that is to enforce positive role modelling. We have also provided SunSmart activity manuals, so they are games and activities kids can engage in at the camps, and that teaches them how to protect their skin in a fun way. So I suppose all the projects have been evaluated or will be evaluated as part of the ongoing work that we're doing. And all of our information and resources are available on hse.ie/sunsmart, or you can also contact the email here if you have any questions. Thank you very much.
Hello, everyone. I'm delighted to be here with you today, virtually, but I'm actually on the Camino, Santiago, walking the line with cancer survivors. So we're living our best lives, doing our exercise in the Irish Cancer Prevention Network space. So the Marie Keating Foundation's commitment since inception has been to make cancer less frightening by enlightening. And what a great space to be in when we're talking about this in social inclusion. With thanks to Deloitte, we have been enabled to put a strong focus on providing free education and support for women and men in underserved communities, namely traveller community groups around cancer prevention and early detection. Our overall plan was to provide cancer awareness in the form of presentations with leaflets, but also with videography, and I feel we've done that really well. If you visit our mariekeating.ie cancer services, you'll see all those kind of presentations and leaflets available in the space. So I suppose the next thing I'd like to really talk about in a little bit more detail is the actual focus group and the questionnaire that Pave Point and ourselves worked with together. And I'd like to thank Pave Point and the primary healthcare leads for working with us in this space. We've actually received some really valuable information. And one of these ladies was an actual breast cancer survivor, and 5 of them were actually engaged regularly with the screening program. So some of the themes that came from the focus group and the questionnaire were that the majority of traveller women and men are well aware of lifestyle choices and the increase of risks in cancer. But the challenge is raising awareness about noticing changes and going to regular screenings. Travellers associate cancer with death, really important for us to know that. And that's where a lot of fear and avoidance comes from. Along with that, embarrassment, along with fear, is another key reason travellers don't go for screenings. And they've told us many stories about people they know in their 50s who've never had screening. So our message really is, together with them, is to feel the fear and do it anyway. So primary healthcare workers think leaflets were the best way of providing this awareness while they're out on site in the sites with leaflets on board. They can actually start those conversations much easier. And I think that's really important. They also felt that the leaflets, together with social media content and a video, were a really good way of actually transferring that information to WhatsApps for younger men and women. Very important, again, to have the leaflets culturally sensitive, with plain English and with the colour coding that attracted them themselves. So again, they want to know about the different stages of cancer, and we know as well through the focus group that currently they receive a lot of their information from their mothers, from their fathers, from the primary healthcare leads, and sometimes from their GPs. So we really wanted to change that concept and that belief. And really what we wanted to recognise here was that they are really agents of their own health. They can positively impact their health by making healthy choices, being aware of their body, and attending screening. And the messages we really wanted to get across here were that cancer awareness needs to be communicated, that it is preventable, but also if it's caught early, it can be treated, and survivorship rates are up and death rates are dropping. Really important information that needed to be put across them. So our impact has been that we've been able to carry out all those presentations that I mentioned. So breast, cervical, ovarian, bowel, and prostate. We have the presentations, we have the leaflets, culturally sensitive, and we also have some fantastic videography invited into their homes to talk about these cancers and the fears that they had and have, and trying to disseminate some of those fears. So they're feeling the fear and doing it anyway. And we have had an indirect impact on over 5,000 people during this project within the Pave Point and traveller community groups. Really thankful for this space. And again, I would invite you to visit our website and make sure that people in marginalized communities and healthcare promoters are aware of these resources and we can use them. Thank you.
My name is Conor McAllister. I'm a general dentist in Dublin, and I'm part of Mouth, Head and Neck Cancer Awareness Ireland. Mouth, head and neck cancer affects about 700 people in Ireland annually, and the incidence of this disease is on the increase, not only in Ireland, but worldwide. The disease has a very good prognosis if diagnosed in the early stages, but unfortunately, in the majority of cases, this disease is diagnosed far too late. The risk factors for the disease are well known, smoking being the greatest one, alcohol, and in recent years, the HPV virus has been identified as being a significant factor in oropharyngeal cancer. The combination of smoking and drinking seems to be particularly harmful. Early symptoms are, as you see, particular red flags would be a sore or ulcer in your mouth that doesn't heal within a 3-week period, and especially a lump in the neck. A recent paper which audited 1,000-odd cases that presented in Dublin and Cork at the dental hospitals identified a couple of significant factors. Number one, 2/3 of the cases presented at an advanced stage. And secondly, GPs were the first point of contact for 3 out of 4 cases. To my mind, this finding highlights an area that we could improve on in terms of reducing the crucial diagnostic delay which can take place, leading to late diagnosis of this disease. It would appear that patients are more likely to attend a doctor rather than a dentist if they have a sign or a symptom in their mouth or in the head and neck area. It would make sense to me if the doctor were to refer the patient as soon as possible to the dentist if they're in any doubt about the nature of the lesion. This would hopefully reduce the delay. The dentist would then possibly just alter a sharp edge on a tooth and monitor the ulcer, for instance, or alternately would refer the patient on for further investigation if he or she saw fit. If we are to improve access to dental care for all communities and increase the number of dental examinations that take place and checkups, then we could significantly alter the rate of occurrence of late stage mouth cancer, certainly. We need as dentists to emphasize the importance of regular dental visits and also for people who have no teeth. And we need to try and improve on the current situation whereby only 30-odd% of people entitled to a free dental examination in Ireland take up that entitlement. So if you go home with one message from this presentation, I'd like it to be this. You need to see a dentist. If, as a doctor or a pharmacist, somebody presents with a worrying lesion in their mouth, please refer them on to the dentist as soon as possible. For further information about this disease, please refer to any of the following excellent websites. Finally, may I say I have little doubt that better cooperation between health professionals and increased use of the dental referral pathway will result in better outcomes for head and neck cancer patients. Thank you for listening.
Thanks to Conor and to all the speakers. I'd like to invite the other speakers now to join us for a quick questions and answers session, if that's okay. Apologies from Conor and from Helen Forrestal, who couldn't join us, but we'd like to welcome our other speakers back, and Lynn Swinburne is going to join on behalf of Caroline Mason-Mahon. So could I start just with a question for you, Kieran? Just, I suppose, in relation to cancer often been seen as a very sensitive topic, how do you feel that worked in terms of the methodology used with a telephone survey and how people reacted to that and engagement with the survey?
Yeah, no, I think obviously a lot of careful consideration went into the design of how the survey was going to be administered, and obviously there was a number of best practice that need to be followed in terms of things like ethical approval, obviously in terms of the research design, but also in terms of in the administration and making sure that the interviewers were equipped to present the, I suppose, questions in the correct manner, but also, I suppose, to deal with any queries and sensitivities that could arise as a result. And that, I suppose, comes through, I suppose, two things. So one is, you know, the interviewer experience that the Ipsos interviewing team would have through the likes of doing a whole variety of surveys on a whole variety of sensitive subjects. It's pretty much the same interviewing team that work on the likes of the Healthy Ireland survey, for example, as well. But also then, I suppose, the additional support and training that was provided by the Irish Hospice Foundation was particularly useful in terms of how to, you know, in terms of some of the listening skills required around this subject area. And I suppose a particular importance then was also that, you know, the interviewers that administered the survey, they're not obviously trained medical professionals. They weren't able to provide, you know, the support that some people might have asked for, but having, I suppose, the backup information that allowed us to refer people on to the appropriate channels, be it through information online or talking to GPs or other health professionals, whatever it might be. That was obviously particularly important as well.
That's great. Thanks, Kieran. I might go to Lynn Swinburne next, who's joining us from the National Screening Service. And then I know there's quite a lot of work underway in the social inclusion space. So just if people are looking for more information on that, where can they go?
Thanks, Trina. Yeah, there's a couple of different places. So our equity report 2021 is on our website, and Áine has kindly shared the link for that. Caroline also mentioned our LGBT plus research that was published in September 2021. Again, we've shared the link with that with you, and the findings of that might be useful for some people to read. We have a public health annual report for the team that I work on, and that highlights all of the different work that was undertaken in 2021. Again, we've shared the link with that. And our PPP strategy is published since 2019, Trina, and that might be useful for some people to see how we're working with our patient and public partnership. So that's available on the NSS website as well. There will be additional resources then added later this year through an equity tool that we're working on for people who work at the community level, which might be useful in terms of how you and your work can promote screening. We're looking at a disability needs assessment that will be published before Christmas as well, with the findings of that. And the Pavia Point project that was talked about a little bit as well. We'll have some initial findings of the bowel screening research that we undertook and the intervention that we did with Pavia Point on that one, Trina. Thanks
for that, Lynn. I might just bring Sharon in next. Can you hear me okay, Sharon?
Yes, I can hear you there.
How are you, Sharon? Just it's World Gynaecology Day isn't too far away before the end of the month. So just in terms of the main message and how anyone listening or joining us today can get involved, where should they go and what can they do?
Absolutely. So thank you, Trina. So World Go Day is on the 20th of September, and what we're trying to do really is highlight the signs and symptoms of the 5 gynecological cancers, but also in terms of the risk factors, and in particular for uterine or endometrial cancer and the link with obesity. So we're having a fun initiative, a Dipper Dance initiative. Anyone interested in taking part can contact me, and I'll put my email address into the chat box. But we'd love groups around the country to take part if they want to. You know, we can swim out, send out World Go Day hats for swims, or they can take part in the dance initiative. So I'll put my details into the chat.
That'd be great. Thanks, Sharon. And can I bring Maria in next? I know we've the next National Skin Cancer Prevention Plan will be underway or being planned for, but can you reflect, Maria, just on anything that's gone particularly well with the first plan that you'd like to share, any particular successes or?
Yeah, sure. So I suppose with the SunSmart campaign, specifically, it's grown year on year. So I know the first year we focused heavily on social media, and then every year we've expanded it further. So adding more press activity, the radio campaign. Now this year we added like digital audio, as well as focusing on more social media platforms such as TikTok, Snapchat as well. I suppose research projects have really helped to inform, I suppose, attitudes, awareness and behaviours, and I suppose where we need to focus more specifically. We know that sunscreen is a very popular form of protection, whereas when it comes to wearing clothing such as a hat, sunglasses or long sleeves or even going in the shade, they would be less behaviours that people would engage with. So focusing on them has definitely helped us. And I suppose in general, building relationships with stakeholders, it has taken time. And I suppose over the years, we have grown a lot in terms of really, really good engagement from various different organisations and groups. And then we just get various learnings as well throughout the plan. So different initiatives and projects, pilots that we've ran, which have helped inform how we grow that further, has really been helpful for us.
Thanks, Maria. And Áine, if I could ask you about, I know you mentioned the e-learning modules, that's 3 of them that are being launched today. So could you just mention again just what they cover and whether can people use them as standalone modules, or will they need to do the whole course, or how will that work?
Yeah, so the modules themselves are accessible on hselands.ie. We've published 3 of the modules today. So we've published alcohol, tobacco and skin protection. The modules themselves, they only take about 10, maximum 15 minutes to do. And the idea is for health and social care professionals to be able to kind of get bite-sized chunks of information about how a risk factor affects cancer risk, which cancers, and also the signposts to supports. You can dip in and out of them. Like if you have a particular interest in one topic, you can just go in and do that module, or you can do them all. As I said, we've published the first 3 today. We do plan to publish more across 2023. So that'll include body weight, eating for health, physical activity, radon, screening, HRT, breastfeeding, vaccines, and workplace carcinogens. So if you had a particular interest in just one topic, you can log on, do that module, or dip in and out of them as you wish.
That's great. Well, thanks to all our speakers today. I hope everyone's found it a very informative and a useful session to join. And I know the chat has been very busy in terms of sharing resources and different links, and a lot of the speakers have shared useful links. So just to reassure you that that information will be sent out to you after this webinar. So we'll share the resources with you again in an email, as well as a link to the recording if you need to watch it back or share it with any colleagues. So thanks to all the panelists for joining us. I said, and thanking them on behalf of the Irish Cancer Prevention Network, who would be Barry Keating Foundation, Irish Cancer Society, Breakthrough Cancer Research, the Irish Skin Foundation, and then from the HSE, the National Screening Services, and the HSE National Cancer Control Programme. And also then just to remind people that if they're interested in signing up to the newsletter of the Irish Cancer Prevention Network, to drop us a line on prevention@cancercontrol.ie. And then the final thing to mention is that you'll also be receiving a post webinar survey. So if you would just take a moment or two to complete that and really let us know what you'd like to hear about in future webinars, so we can make these as useful to everyone as possible. So with that, we'll draw to a close, and thanks to everyone for joining us today.